Welcome back. With the recent decision by the CDC to approve the COVID vaccine for little ones, we thought it'd be a good chance to talk with our Tulsa pediatrician to get some more details. We welcome back to the program Dr. Cyrus. And we've been kind of waiting for this news to come out. Did it surprise you at all that the CDC would go ahead and do this?
It really didn't. The information that we have for the CDC and for the FDA, they both approved it for the infants, was just a matter of getting enough of the research done, and we have, of course, have all the background of the adults, the teenagers, and in age down to 5.
Let's talk a little bit about why this approval is so important. You have this graphic, and I thought it was kind of important to talk about when you have a vaccine that can maybe even, obviously the goal is to stop death. That's the ultimate, because these diseases can run rampant and they can kill. Exactly.
And that's exactly right. When you see the pediatric vaccine preventable diseases, because they cause death, and if you look at this graph, you can look at hepatitis A all the way down through rotavirus, and the amount of children dying from these diseases in this time period, the maximum was 20, and we have had over the last 2 years 86 children die from COVID. So you can see it really is important that we take this disease very, very seriously.
All right, we have another graphic. Let's kind of break down, what does it mean when you talk about COVID for young kids, the ages that are involved, how many kids, how many cases we've actually seen?
Well, that's really important, because you think about this vaccine has expanded coverage to almost 18 million children, and so it's very important to look at it from that standpoint, because we have 570,000 cases to date that have affected babies, and 1.9 million cases affecting the 1 to 4 year olds. So getting them from 6 months of age all the way up to 5 at this point in time is extremely important.
What about the actual vaccine? I know parents are going to be concerned, as they often are when it comes to a newborn, a young child, that kind of thing. What is kind of the timetable? At what point, how many vaccines will there be, and what can they expect?
During pregnancy, mom can, if she has COVID or she has the vaccine, she can actually pass along antibodies to the baby after the baby's born. But those antibodies probably last about 6 months is our best estimate. So that's why many times, like the flu immunization starts at 6 months. And so we want to make sure that that's started at 6 months. The Pfizer vaccine is a 3-dose series. The Moderna is a 2-dose series. It gives them both coverage. There is a booster, that the timing wise you have to look at potentially. And this again look much like what we're seeing with the flu. And so we may see yearly boosters along with the initial doses.
Now, I know I just got my booster, my most recent booster, this past week, and I know that I got it at a local drugstore. Is that where you're recommending, or should people call their pediatrician? How should they advance if they want their little ones to be vaccinated?
When it comes to always check with your pediatrician. I think that helping, you trust them, you get guidance from them, so check with your pediatrician, check with your physician. I personally don't have them in my office because it's so readily available at the CVS, the Walgreens, the Walmarts, all the different places there are, and it's many times to be able to walk right in and to get the vaccine is a much more convenient way. And I always say, make life convenient as much as possible.
Especially when it comes to kids,
That's
right?
right. That's exactly
What about
right.
side effects, or what right after can they expect?
We see minimal side effects, but a lot of times we see a little bit of, kids being tired. There may be a little bit of fever going on, just like many times other vaccines that the mothers and dads are already used to with the regular routine vaccines that the children get. And that brings up the point of this can be given with other vaccines in the routine immunization record.
Good to know, and just keep those records coming. I also, real quick, I have about 30 seconds. You won a special honor, and I meant to write that in there, and I completely forgot. Tell me what it was again.
Our national college, the American College of Osteopathic Pediatricians, I was awarded the National Pediatrician of the Year award. So thank you very much for bringing that up.
I did. I knew that, and I apologize because we're very proud of you. That's a big honor. So thank you, Dr. Cyrus, and we appreciate your time that you give to our show.